This is CGTN, China Global Television Network.
Hello and welcome to World Insight Special on COVID-19, live on CGTN. I'm Tian Wei. According to the WHO, the US has already become the epicenter of the coronavirus pandemic. What exactly are the realities? What can be done to save lives? We are bringing together today Chinese and American doctors, together with health experts, to try to find out the realities and also the way forward. To join us today, we have 5 of them. They are, in Wuhan, Dr. Fan Jinping, attending physician of pulmonary and critical care medicine from Peking Union Medical College Hospital. In Providence, US, Dr. Megan Ranney, emergency physician and researcher at Brown University. In Seattle, we have also David Zhang, FACC inpatient director and also CHI Franciscan Medical College Center. In Atlanta, Carlos Del Rio, executive associate dean of Emory University School of Medicine at the Grady Health System. Last but not least, we have also in New Haven, Dr. Howard Foreman, director of the Healthcare Management Program. I want to welcome all of you to be with me today. May I start by asking, if I could have some of you on the screen, by asking Dr. Fan from Wuhan, tell me more about the ICU situation now in Wuhan, which is, of course, the epicenter of the outbreak in China. Dr. Fan, briefly.
Okay, well, thank you for the question, Dr. Tian Wei. Well, I'm a resident right now in the ICU ward of Wuhan, the epicenter of China. And we have a setting of 32 beds in total. And right now we have about 20 patients, which are still in a critical situation right now. Part of them are admitted directly by us. Some of them are transferred from other centers. We're still trying our best to save them. That's the brief situation here right now.
Mm-hmm. Well, listen to you, I'm sure, remind some of our colleagues inside the United States as to how they are fighting on the front line. Can I go to Dr. Zhang in Seattle? Tell me more about your situation. The state of Washington, of course, is one of those epicenters inside the US.
So this is Dr. David Zhang. I'm a cardiologist at Seattle area. Actually, I'm in charge of the ICU, cardiac ICU, and
yes, we do.
Advanced
so
heart
go ahead,
failure.
Tell us about what is going on.
Yeah. So in the United States, actually the first case was diagnosed with COVID-19 actually was here in Seattle, I think on January 21st. And since I would quiet down for a while, at the end of February, the first death case reported also in the Seattle area, which in one of the nursing home in Kirkland area. So since then, our case number has been increasing almost a daily basis. And as of today, we reach around 5,200 patients with deaths around 220. And that's basically the situation we are now. And we were the epicenter, I think still is. However, in the past, I would say in past 5 days or 4 days, and New York State or New York City actually has become the number 1 epicenter in the United States. Overall, I think we are fighting with the same disease, same enemy, pandemic. I think I appreciate this chance, opportunity. We can share our experience, learn from our colleague and the frontline doctors in China, Wuhan, and together we can, learn and save our patient, take care of patient, fight this pandemic.
What about for you, Ms. Rani, the situation where you are and your assessment of the ICU inside the U.S., briefly?
So as an emergency
so it's
physician,
changing daily.
I am responsible for...
Mr. Rani, please.
Yeah. Oh.
Yes. As an emergency physician, I am responsible for all patients who come through the doors of our hospital, those who have COVID-19 and are well enough to go home, as well as those who have to be hospitalized or put in the intensive care unit. We are seeing growing numbers of patients who are admitted to the hospital and admitted to intensive care. We're a little bit behind New York up here in Rhode Island, but day by day our numbers are climbing significantly. And as I'm sure you've heard about on the news, we're facing significant shortages of personal protective equipment, things like gloves, masks, gowns, but also shortages that we anticipate in things like ventilators and other critical equipment to help care for our patients.
Let's take a look at some of the information we have gathered over the days about how prepared in terms of ICUs in each state of the United States. And take a look at this. The country is tackling with the COVID-19 outbreak, of course, according to a study by Professor Adam Sakarni of the Columbia University and Washington Post. Recently, we have found out, let's look at this chart. New York City's ICU capacity was about 2.4 per 10,000 inhabitants. It was ranked 220 out of 305 hospital regions. San Francisco has 3.6 ICU beds per 10,000 people, while large hotspot cities that are better equipped, including New Orleans, that has 20.4 beds per 10,000 people, and Chicago with 21.1 beds per 10,000 people. Having said that, though, this is only about the beds, but what about the equipment? I'm sure everybody at the very beginning of the crisis dealing with the scarcity of resources. Dr. Fan, how were you and your colleagues dealing with that at the end of January, early February, which is the most difficult time for China's outbreak?
Well, that was really difficult for a lot of us, especially for those medical staff here in Wuhan. I believe they have been through a very tough time then. We entered this battlefield at the beginning of February when things are getting better gradually, just because all the provinces outside of Wuhan, outside of Hubei, has sent medical staff and resources here. Generally, we have not experienced a shortage on personal protection equipment and gloves and N95 under all efforts provided by the government and other counterparts. However, the patients here was really critical, and there are many of them. We feel a great burden in terms of caring for those critically ill. However, we made a great team here in Wuhan, and also besides us, there are multiple medical teams set up for ICU patients all over Wuhan.
Dr. Fan, now in retrospect, maybe things looks easy. But let me ask you, Dr. Fan, if I could be very direct here. At the very beginning in the news, we heard a lot about the lack of resources for the frontline doctors and medical personnel in terms of masks and also protective gears as well. Some of them were also, like their colleagues now in the US and Italy, even wearing the trash bags just to somewhat as a comforting mental protection, but actually could not prevent them from being infected in the ICU. So tell me more about how did you get hold of those equipments and also masks, protective gears? How are those problems being resolved in the China circumstances? Then we go to our US doctors to ask them how they are trying to solve the problem. Go ahead, Dr. Fan.
Okay. Well, yeah, there have been some kind of messed up right now at the very beginning, just because the virus is quite new and it's affecting the society with unprecedented manner. But we solved this problem using multiple ways. The first one, I believe, the production capacity has been immediately boosted up under the effort of the government. Secondly, we have accepted a lot of donations from all over the world. Thanks to them, Thirdly, we also have found our supplies from in multiple ways. First, they have accepted donations, which I've mentioned before, and also there are some stock up inside different hospitals, since all the medical teams sent to Wuhan and other counties of Hubei province are from all over the country. Personally, as a member of PMC, the hospital have prepared a case of resources for us, which we didn't use actually, just because all the supplies followed up. But we have some spared ones. We made this problem solved using multiple ways.
But Dr. Fan, if I could, is it just the individual example of your hospital, which is one of the best hospital in China, and therefore you have plenty of resources, or this was general situation for all hospitals? Because we heard a lot of stories about not having access to the right equipment and the right materials. Tell me more about that.
Yeah, I'm glad to share the fact that among all the medical staff who were sent to Hubei, including Wuhan, none of us get infected as due to the report, and just because we have enough PPE and a 95 mask. Well, I believe at the very first time there must be some kind of shortage, just because patient boosted up. The patient number accelerated quickly. But after a certain period of time, we have made our strategy a right one, including the Fangcang Shelter Hospital, which have been used to quarantine large number of patients. That was a very important step in this control of the pandemic here in Hubei. Just because the patients' numbers stopped growing quickly, so the need for, or the demand for PPE, such as PPE, has been shrinked.
Okay, but we have heard also reports, if I could, Doctor, that there are a lot of local hospitals, medical personnel who were infected. In fact, the number is quite huge. So you are suggesting that all of the doctors coming into Wuhan are much better protected than the local ones? Is that what you're trying to indicate here?
No, that was not my intention. I have to say, there are medical personnel who got infected, but
a lot of them actually at the very beginning.
Most of them happen in the initial stage.
Yes.
Just because we are not. Because I have done some basic surveys to the local friends who are also working in the hospitals. When they got enough information about this new disease, a new virus, they have set up, the quarantine ward, and they have applied appropriate protection setting. So the infection rate among medical personnel were largely reduced.
I see. Dr. Rani, when you hear your Chinese colleagues talking about the initial stage and also the later stages of preparedness, do you think you are also going through one of those processes, as he just mentioned? What are some of the ways for your doctors and medical people to get access to the material needed, resources needed? Ventilators, we're going to talk a little bit later separately, but what about the masks and the protective gears?
So we face a number of challenges in terms of getting the protective gear. We unfortunately were not able to stock up during the time that Wuhan and the rest of China was going through the worst of the pandemic. And so now, as the disease is starting to rise in the United States, we're all depleting our supplies and we're unable to refill our supplies at a rate that's adequate. That's for a few reasons. The first is obviously many of our supplies are actually made in China, and those were kept in China during the epidemic appropriately, and only now are just starting to come back across the border and be imported. We also now have hospitals and states across the country that are competing to try to get the few supplies that are here. And as a result, many of our hardest hit hospitals are literally running out of N95 masks and other essential protective gear. In response to that, a group of us as physicians have actually created our own website to try to get donations to hospitals and health clinics in need. Dr. Tian Wei helped found, along with me and a group of other doctors, getusppe.org, where we are matching donations with healthcare workers in need, simply because we're not doing, at this point, a strong enough job in the United States of distributing protective equipment where it is most needed. I am hopeful, though, that our government is beginning to step up and activate production locally in the United States, as well as to help distribute protective equipment more effectively across the most affected areas in the U.S.
Dr. Zhang, the state of Washington, of course, has more interactions with the Asian countries, looking at the history. Is the situation there different from what Dr. Rani just said?
I agree with Dr. Rani. So we had a similar situation with the shortage of supply of all the PPE. And the only difference that, because I think we were like, the first case was reported here. So whole state of Washington, the social distancing, everything they start pretty early. So far we don't see the number, like we're number climbing, but climbing at a very slow speed. That's the main strategy. The two strategies. The federal government talk about containment, and the other one is the mitigation. I think because of mitigation, so our supply demand problem is not as a big issue, significant as New York and Rhode Island, but we do have similar problem though.
Yeah. We would like to thank Dr. Fan from Wuhan. I know you're going to prepare our connection to Zoom later to talk to some of the other colleagues later on our show. Thank you so much. But I want to talk continuously to our two American doctors, Dr. Rani and Dr. Zhang. It is not just the equipment. It is also the ventilators. We have heard about the debate between New York, the state of New York, and the federal government about whether it's 300,000 ventilators needed. Putting that aside, how much inventive way are you trying to use in order to come up with the best solution to the lack of it? Dr. Rani.
So we're working as physicians and healthcare systems with both the federal government and with manufacturers to try to both increase the production of ventilators and to distribute them equitably. We're also working on innovative new solutions, like figuring out if there are ways to use the same ventilator for multiple patients. And of course, we're constantly relying on new science, such as that produced by the folks out of China who've already been through this epidemic, to help guide us in terms of the best treatments that will lower the infection risk for our healthcare workers while also protecting and saving lives of patients.
What about the ventilators? What do you make of that issue? That seems to be a hot debate.
Yeah, so we're predicting that we're going to need up to 1 million ventilators across the United States. Our strategic national stockpile, in addition to the ventilators currently in distribution in the United States, we estimate that there's around 160,000. So we're going to have to either really slow the spread of this disease or get a lot of new ventilators up and running pretty quickly. As I'm sure you heard, Governor Cuomo today proposed that within New York State, that various hospitals all work together and move patients around, so that if New York City gets overwhelmed, that they move patients out into other parts of New York to try to use spaces where ventilators are still available. We're really looking at all available solutions right now.
That is a very interesting solution, Dr. Zhang, because the U.S. System is very different from that of China. You know both ways. China had the epicenter of Wuhan. Everybody run to save Wuhan, bringing all the resources, including ventilators. So Dr. Fan, earlier we talked to, they did not have many problems regarding that. But for the U.S., it's a different story, and we see different epicenters in different parts of the country. So how do you see the situation of ventilators? What do you make of what Dr. Fanny just said, Governor Cuomo's call of cooperation? Is it possible?
Yeah, that's a good question. So, yes, you're right. So I have, I grew up in China, and I know the both system pretty well. And so ventilator is a critical, and for the patient go to ICU or for the severe patient with COVID-19. So, the reason there's short of supply, and because always supply and demand in the market, right? So I think the three sources we can rely upon, and the current, I will talk about the PUMO proposal, then increased production and donation and help from other countries, including China. So the way I look at the ventilator, right, I think I was listening to Governor Cuomo's press conference this morning as well, and I would summarize the strategy will like a centralized and decentralized. So what's that I mean? So he mentioned a really good point, which I totally agree, just similar like a China way. So you have so many hospitals in New York and a small number of public hospitals. Either one or combined, either one, they could not handle this crisis alone. So you had a centralized system to share the information, share the stockpile, borrow a ventilator and to help each other. Besides that, right? So Dr. Rani can comment on that. For me, I always think it's not just a ventilator issue. It's all about the staff, right? You need the critical care physicians. You need the respiratory therapist.
Absolutely.
It's a system thing. It's a systemic work. So we all need the staff. Be trained, be ready to manage those ventilators. Decentralized, I would mean, so decentralized because in the United States system, I would call hotspots because there are too many centers now. So each, like NYC, they could not handle this alone. They probably should send some of the patient out to upper state, lower state of New York, which have a less patient with the COVID-19 called decentralized. And this was not, not done in China because China already contained the disease at the first place. So they did not need that step. I would use state of Washington, for example. That what exactly happened. You probably know the first, all the cases came from the one nursing home.
Yeah.
So they basically sent all the nursing home patients to one hospital, quickly disable that hospital. So other hospitals, so what we did is other step up and they shipped the patient, transferred the patient to the different hospitals with the ICU beds. So that relieved the burden of the main one, which is called Evergreen Hospital.
Right.
So the other hospital can join this fight. And so far, so far our ventilator, its issue is not as strenuous as a East Coast, but I think so there should be in many ways or we have to be innovative, find an innovative way to fight this virus and also the soft ventilator problem.
We are getting smarter. However, challenges are always overwhelming. Having said that, though, it is not just the ventilator, as you said, Dr. Zhang. It's also about the staff. It's also about all kinds of resources. It's also about how to make the system work. Dr. Rani, coming back to you, very critical point. Earlier on the phone, before our show, I was asking Dr. Fan, who is now preparing for his Zoom now, is what kinds of situation he had to deal with in the ICU in Wuhan at the height of the crisis. He said he is one day, one shift, taking care of 9 critical ill patients, all at the same time. One person, 9 patients. That is almost impossible, mission impossible, but they try to do it. So Dr. Rani, tell me about your situation. What is the smartest way to make the best use of people resources?
So Dr. Foreman, who I know is on the show with us tonight, and I helped author a series of policy recommendations actually for the federal government about how best to coordinate the use of staff and equipment and our overall public health infrastructure. We're having a lot of discussions within the United States right now around relaxing our medical licensing rules. Usually in the US, I'm licensed in Rhode Island. I couldn't go help Dr. Foreman in Connecticut because I don't have a license in Connecticut. Well, in the context of this epidemic, we're relaxing those licensing so that I can go and help in Connecticut if I'm needed, and vice versa. He could come up to Rhode Island and help up here if needed.
Yeah.
So that's one way that we're trying to deal with those staffing shortages. We're also communicating among physicians across the United States. We have Facebook groups. WhatsApp groups. We have online compendiums of information to try to share new information as quickly as it comes out, both to save staff and to help our patients. The last thing is, of course, we're worried because of the lack of protective equipment. We're worried about ourselves getting sick. And you mentioned, we watched with great anxiety the reports coming out of Wuhan of healthcare workers there getting ill and even dying. And it is something that we're all worried about. I have numerous friends in the New York City area who have already fallen ill and even been hospitalized with COVID-19.
Yes.
And as our doctors and nurses and respiratory therapists get sick, we're then going to have more significant staffing shortages. And again, I'm hopeful that we'll be able to move folks around between states, but that's only if we can stave off the infection so that we're not all infected at once. Because if everyone is an epicenter at the same time, then there's no extra staff and no extra equipment to share.
Indeed. Another thing is who to save. This is a very cool question, actually. Very cool. But sometimes ICU doctors have to quickly come up to a conclusion as to who to save and to what degree to save. When is it time to give up? When is it time to say, let's continue? How is that critical decision, a very difficult decision, being made in a crisis that is changing so fast every day? Dr. Zhang.
I think that's a great question. Actually, for me, at my job, I'm dealing with that every day because I'm a heart failure doctor and all my patients really sick. Just like this COVID-19, so there's no cure except transplant. Not everyone can get it. So most common strategies we're using to support is therapy, just for this virus. And sometimes because those patients need all the supports, we call mechanical support, resources are limited. There's a this kind of discussion. So I think for COVID-19 with similar situations, when the system, if we talk of ventilators, when we have enough ventilators or enough staff, so we can handle it. We do not need to discuss this. And however, when they reach the point, we might need discuss that. Basically, we're talking about a patient selection, right? So the good thing about a patient selection, I think, is two ways. And when I talk to this patient and their family, I found out a lot of time, they have their own thinking, a decision, how they look at end of life, and they do power of attorney, and someone has the DNR, DNI order already. So those kind of discussion, and eventually, I think when our system is overwhelmed in the United States, we may need more. To be honest, I think we should have the discussion for every patient, every case, if we have time. Involved in the ideal situation, right? So you involve social worker and primary care doctors, discuss with the patient before intubate. Intubation happens. But I heard Italy already have this kind of discussion.
They have long had this discussion. Yeah, exactly. That. They have long had this discussion in Italy, almost from the very beginning because of the situation there. So Dr. Rani, I want to have you also to comment on this before we wrap it up.
So we're certainly hearing reports out of our colleagues in Detroit that they're already having to make some of these very difficult decisions. And I will say that many of us in the United States are urging our patients to have very honest discussions with their families about their wishes for resuscitation or intubation, about their wishes for those heroic measures, and to have those discussions before they get sick. Because once someone is in my emergency department with COVID-19, they're not going to be able to see their family. We're going to keep them isolated in the ER or even up in the ICU. So it's something that is a big topic of discussion among bioethicists here in the United States right now. And many hospitals are coming up with hospital-wide guidelines that individual doctors don't have to make that tough decision at the bedside of an individual patient.
I see. Before we go, we want to have both of you to answer some questions coming from our netizens. People are watching what you just said. Netizen comments, quote, from this is from @DDAsk. It's not a competition, politics or not. Ordinary citizens around the world are innocent. Everyone should focus on overcoming this terrible virus. I think this is a comment rather than a question. Just a quick response coming from Dr. Rennie. Very quickly, please.
I agree completely. This is a time for us to come together, certainly within the United States, but also across the world, because that's really the only way that we are going to combat this epidemic.
Got it. And there's one from Wise Chokuda. The question is staying at home lockdown the cure for the virus? Namely, the question is whether staying at home is the cure for the tackling the virus. Is lockdown the best way? Dr. Zhang, maybe you want to take that briefly.
Yeah, that's a really good question. So in the state of Washington and California, we call it shelter place. I think New York has a similar name. There's discussion again this morning on the Cuomo's conference. I think that question all the time. I think it will work if the home, shelter in place really the community. So everyone follow that instruction to really stay at home, do not go out, and unless it's really necessary, right? If we really follow that, I think that's going to work.
Okay.
End of the day, except in New York and rest of the country, the population not that dense as like China or Europe, right? So that's their advantage. But if they don't follow the instructions, we may need eventually think about like what they mentioned, the Fangtang model, to isolate those patients with mild symptoms together in one place.
All right. Dr. David Zhang, Dr. Megan Rani, and earlier we talked to also Dr. Fan Junping. Thank you so much. Thanks a million for your efforts to save lives in the emergency rooms and ICUs. You're watching The Frontline, devoted to the fight against the COVID-19 pandemic. Stay with us. We're going to deal with later more situation going on inside the United States, which is described by the WHO as a new epicenter of COVID-19. We'll be back after this. Welcome back. You're watching The Frontline, a World Insight special episode on COVID-19, and this is a live webinar. Now we are joined in Atlanta by Carlos Del Rio, Executive Associate Dean of the Emory University School of Medicine at the Grady Health System, and in New Haven, Dr. Howard Foreman, Director of the Healthcare Management Program with the Yale School of Management, and still with us, Dr. Fan Junping from Wuhan. Thank you so much, gentlemen, for waiting for this segment of the discussion. Thank you so much. I want to start by asking Dr. Foreman. We heard from Dr. Rani earlier talking about your joint project, how to help with the frontline situation. Now, how to smooth up the system probably is something you're thinking about every day. Your take here.
We have several problems going on simultaneously. There's a coordination problem at the federal level that in ordinary circumstances do an excellent job of bringing together resources from across the country. This is something that we've done historically over decades. We've dealt with both disasters as well as military war by bringing the country together and mobilizing our resources, both and manufacturing, to deal with problems very readily and very quickly. And under the current circumstances, what we're seeing is discoordination and a lack of leadership to solve a lot of these problems. Fortunately, we are seeing some private sector and public-private partnerships rising up at the state level. And we're watching our hospitals and local leadership at the city and state level mobilize resources on their own. But this is obviously not an efficient way to do things. And it's something that now we're going to have to continue to deal with in a rolling way over the next several weeks.
Yeah, unfortunately, that is the situation. So let me go to you, Mr. Del Rio. We already talked for several rounds already in the early program, but What is your take of the latest situation? Once again, smooth up the system.
So what the United States is experiencing is multiple Wuhans. We have not one epidemic, but we have outbreaks, and we have epidemics in Seattle, in New York, now in Louisiana, in Atlanta, and Miami. So there are multiple places, and each one of those cities has different characteristics or different epidemics. In Washington State, you have an epidemic that primarily is affecting older people that went into a nursing home. So there's going to be a very different epidemic than an epidemic in Miami or an epidemic in New York, which is a more generalized, very extensive epidemic. The levels of testing in each one of those cities is very different. So as Dr. Foreman said, we don't really have a US epidemic. You have multiple epidemics that have very different characteristics. And therefore, you need some national guidance and coordination, but the response and the way to allocate resources has to be local. So when the governor of New York says, this is what I need in New York, we need to listen to him, but that may not be what we need in Georgia or what we need in California. Each place is a little different. And therefore, the control at the local level is really critical in addressing the local needs as an effective way.
Dr. Fan, of course, the US is a little bit different from China. From your perspective, as a frontline ICU doctor, how to smooth up the system? Any suggestion and any lessons you learned over the past few months?
Well, I totally understand this is the hard time for each and every one of us, especially at this stage of the pandemic. Well, I believe, first of all, prevention always comes first. Well, a lot of people believe that as doctors and the nurses are at the front line, but actually we are not. We are the last line. If you have patients in our hands, they have a very poor chance to survive. That is just not right to solve the whole problem. We should put the front line to every people. All the population should be aware of that. They are the first line of this pandemic. They have to adopt appropriate strategies such as hand hygiene, room ventilation, also wear a mask if it is possible, just to stop the virus getting to them and to their family. That prevention always comes first. That's my opinion.
How is the prevention work being done, Ms. Foreman?
So I think that it took a few weeks, but I think that most of our states and certainly a lot of our more urban municipalities have taken this very seriously. And I think that if you're around now, you see a very different culture and a very different awareness than was present even 2.5 or 3 weeks ago. So we made a lot of progress in that direction. You see the social distancing, you see the hygiene issues being addressed very aggressively. And I think that we're on that path in a good direction. I think the other component of that is the testing piece, which we're not doing nearly as well at, both on a national level and in most local areas. So we're not necessarily on top of where the outbreaks are. We have some sense, but we're not nearly able to educate people as to what areas are the biggest hotspots.
Mr. Del Rio, of course, we know about the new test kits available now. It is said at least 15,000 a day likely to be tested. One could also mail it. So what exactly is the real situation? Because we heard a lot of reports, but people are still saying they do not get the chance to test.
So we still have a problem in the United States with access to testing. And while we have an important scale up, today, in fact, the United States passed 1 million tests and approximately 143,000 Americans have tested positive. We need to be doing 1 million tests a week. And part of the problem is, yes, the kits, but the other problem is just supplies. For example, there's not enough nasal swabs to obtain samples. There's not enough things like, for example, RNA extraction of liquid and material that you need to extract the RNA to do the test. So, and there's also a throughput problem. For example, at my hospital, we have a machine by Abbott that can run 90 tests in an 8-hour period. So the most you can do is 270 tests a day, no matter how much kits you have. That's the limit. The limit is the throughput. So we have ordered another machine, but until the other machine arrives, we are limited to 270 tests. So there is an issue. Just people think it's a kit that you just like do it in your kitchen with a like a recipe, but no, it's a process, and the whole process needs to be looked at. So the scale up of testing needs to happen. It's happening slowly, but my goal would be that over the next several weeks, the U.S. could be testing 1 million people a week, and I think we're probably going to get there in the next 2 or 3 weeks.
Okay, 1 million people a week. I'm noting down that number. According to the U.S. president, 100,000 to 200,000 people death. That's the number he's been talking about. As long as within that range, he said it will be a success already in terms of combating COVID-19 inside the U.S. Dr. Foreman, do you agree with that?
I think a success is to avoid every possible death that you can. And I think the fact that we got such a late start undoubtedly means that tens of thousands of people will lose their lives prematurely. Everybody loses their life eventually. So it's not a matter of quantifying numbers. It's a matter of how many people could have had a more full and long and healthy life. And we've lost precious time over the last couple of months. We can still make back a lot of that. We can still pick up from where we are and not look backwards, but look forwards. But even looking forwards right now, we still have major coordination problems around testing, around ventilators, and about personal protective equipment.
And I would say that the numbers, I don't like to talk about numbers because each one of those is not a number, but it's an individual, it's a person. It's somebody's family member, it's somebody's relative. It's a person, and if it's a relative of mine, that one loss, it's very important. And I don't care if it's 10 or 1,000. I have that personal loss. So we need to think in the terms of individuals. And I really like what was said about prevention. Each death we can prevent is actually important. It may be a relative of yours. It may be yourself that actually is prevented from dying.
Yes.
Dr. Fan.
Mm-hmm.
Maybe not about the U.S. situation because their government and their people are going to decide on what approach to take. But from your perspective, I mean, as an ICU doctor, how do you see one life and lives?
Well, I totally agree with what the two doctors say here together with me. I believe every life matters, just because behind every individual number is not important. It's only a game of numbers. Well, but every number behind it, it's an individual, and behind every individual there is a family. We want to save everyone and every life, just to help their family. But in this situation, in this pandemic, it's a really hard job to do. But we're still trying. Just like everyone agrees, we should focus more on people, on families, less on numbers.
I know you are still trying because you are still in Wuhan, in the epicenter. Of course, Wuhan is very different now compared to 2 months ago, but people still need to be very careful at this point, including those in the ICU like yourself. Having said that, we have some questions coming from our netizens who are sending the questions through various social platforms. One is coming from Facebook. I hope I pronounced this person's name right. Tabogo Church Mochabane. I guess that's the way to pronounce it. So what caused the pandemic? That is still the question. Like, we have viewers coming from different parts of the world asking questions in different natures. So you want to take that, Mr. Foreman, very quickly? What caused the pandemic?
Well, I think that when a novel virus is introduced into sort of human community, and it's a naive immune system in the entire world, the ability for that to spread quickly, and particularly this, which has a fairly substantial asymptomatic period where people are spreading a virus to one another before they even know they're infected, it sets it up for a quick spread. If you're not aggressively testing and implementing all the things that we've talked about from the beginning, you can lose your opportunity for containment, and you're left with mitigation, which is where we are in most of the world right now, is we're in a mitigation phase.
And another question, maybe I should address it to Mr. Del Rio. Who came with the name of COVID-19? This is a question coming from the same person.
COVID-19 was a name that WHO came up with, and that COVID-19 is the name of the disease. The International Association of Virology came up with the name of the virus as SARS-CoV-2, and they call it SARS because it's 96 sequence homology to the SARS virus that occurred 10 years ago or so. So we need to think about, but I don't like the name of SARS-CoV-2 because it's too confusing with SARS. So I like to call it the COVID-19 virus, but the true name is the SARS-CoV-2 virus.
Got it. And another question I want to address to maybe Dr. Fan, since this is more related to China. We have viewers asking, what do you make of the so-called debate about the asymptomatic patients?
Well, asymptomatic patients are very important subset of patients in this pandemic. Actually, we kind of, because the virus in retrospect is very treacherous and slippery, mostly due to the existence of asymptomatic patients. Those patients who are asymptomatic does not mean that they cannot spread the disease. Actually, they do. Because they live in a community, in a family, and also they are shedding virus and making people around him or her get infected. And also such patients, because there's less or even no symptoms, so they are very active. They can live almost normal life. So the activity they participate can be in a very large scale. And that's a very important subset of patients to cause a very severe pandemic.
Okay, there are a lot of debate, of course, going on as to how to solve that problem, not only in a country like China, where the original epicenter was, but also in some of the other places, such as in the US. Dr. Foreman, you want to take that question very quickly about the asymptomatic cases. Is massive testing likely to solve that problem? Because we do know there's a delay in terms of when you test and when the result comes out. So would that be the best way to solve it? What is the best way to solve it?
Well, first of all, if every single person assumes that they're potentially infected right now, that can help a lot. So if every person takes personal responsibility and accepts the fact that they may be infected and therefore they should be very careful about who they touch, what they touch, and who they come in contact with, that helps a lot. Testing does help a lot because it starts to identify communities where the outbreak is greater. I think South Korea has done a great job at massive testing. Even now, about a third to half of all cases that come up every day in South Korea are imported cases. And the only reason they're finding them is because they're testing massively at the airport and then subsequently from that. So a combination of personal measures as well as testing can help mitigate that.
Right. My last group of questions has a lot to do with the way forward. Now, we know that right now, gentlemen, China seems to be earlier in the fire, now in a better situation, only apparently. Meanwhile, the rest of the world, Europe, North America, is in the very middle of this crisis. Likely to April, end of it, nobody knows. But the thing is, whether the virus is going to continue to challenge us probably in a bigger way, because the spread that could be coming in cycles. And what would that mean for all of us? Mr. Del Rio.
Well, I think, I don't like to think about that because I don't know if the virus is going to come back in cycles or not.
We don't know.
What I like to think is that science is going to help us. And there's a lot of research happening in antivirals and in vaccines. And if that research continues and is successful, if the virus were to come back, it'll be a very different situation. Because if the virus comes back, we will have testing, we will have treatments, we will have vaccines. So it's not going to get us in the same situation that it got us this time around. So science is going to make very different. So a return of the virus is not going to be nowhere similar to what it was today. So I don't like to think about that because it's like thinking about two different novels, two different books. It's not the same thing. And therefore, we need to support science, research to create treatments, to create vaccines. It's going to make the difference in how this virus returns.
We're thinking about the daily battle we're fighting right here, and we're also thinking about real long term, which is supporting science and research. Dr. Fan, your take briefly.
Well, I totally I totally agree with it. As I know, a lot of research are taking their way, including multiple methods of developing vaccines domestically and internationally. I am quite curious and optimistic about the vaccination. Well, another thing I want to add is, it's a metaphor. It's not the real case. I believe our whole society, international society, are kind of immunized by this pandemic. All the parts of the society, including medical staff, people, government, and also industry are well aware of this pandemic. They know it, and so when things come again, they will be better prepared.
Vaccination at this moment means awareness, right? And the willingness to work together. It seems that the vaccine we already got in hand, whether we want to use it or not and use it smartly, it's really up to us. And finally, before we go, Dr. Foreman, also your take.
I just think that we've changed dramatically in 4 weeks, at least in the United States, and I think all throughout the world in ways that we never could have imagined. Just 4 or 5 weeks ago, the president of the United States, many others said the United States could never do the things that China has done or South Korea has done. It's just not the way America can operate. America now sees that they have to change their behavior and they have to work with common goals toward massive testing, to protective equipment, to the development of pharmaceutical intervention, including vaccines. And I think we've changed in that way for the better. And I think, as you say, it's almost a vaccination health in the sense that hopefully we'll never be caught as unaware as we seem to have been in the last several months.
Got it. Howard Foreman, Carlos Del Rio, Fan Jinping, thank you so much, gentlemen, from China and the US for working 24 hours a day trying to focus on fight against COVID-19. We thank you a lot, gentlemen. Really appreciate it.
Thank you. Yeah.
Be well. And that is all the time we have for our special episode, our also a live webinar, The Frontline on the Global Efforts Against COVID-19. Thanks for watching, and do tune in today on Tuesday, Beijing time, 22:15 on CGTN for World Insight with Tian Wei. We'll air an edited version of this just taking place live webinar. And that's all we have for today. Next week, we're going to focus on the city of Wuhan and what's going to happen to that city after that. If you'd like to see more of our program, try to find us World Insight CGTN, and also follow us on Twitter, Facebook accounts, and our YouTube channel. I'm Tian Wei on behalf of the team. Thanks for watching. Bye for now.